Hi, my name's Bonni Goldstein, and I'm going to be talking about mechanism of action for CBD and other cannabinoids. Disclosures: I'm the medical director of Canna-Centers Wellness and Education, my medical practice in Los Angeles. I'm a consultant for Zalira Therapeutics, and I'm on the Policy Advisory Committee for Americans for Safe Access. In terms of my background, I trained as a pediatrician at Children's Hospital Los Angeles. I went into the field of critical care transport and pediatric emergency medicine for many years. And in 2008, I made a transition to become a cannabis physician after witnessing the benefits of cannabis in a friend. I have since authored a couple of books, my latest book being Cannabis is Medicine, which was published by Little Brown Spark last year. Now let's get into the science. So CBD, everybody's talking about CBD. You go into a gas station and you see it. Every celebrity has a CBD line now. So why all the hype? What's the deal with CBD? Well, we know CBD has all of these different medical properties. So anticonvulsant, anti-inflammatory, antioxidant, and so on. How possibly can one compound have so many different benefits? And so what we've learned is that there are over 65 discrete targets of action that have been described for CBD, which means that CBD works at multiple places throughout the brain and body. That's how it gives all of these different effects. And I'll go into some of the details in this lecture. We know CBD is not intoxicating. We know low doses can be somewhat alerting or uplifting, kind of like caffeine. We know that higher doses can be sedating. And it appears that CBD has no tolerance. Potentially, there's something called reverse tolerance, which is the opposite of tolerance. So tolerance is when you need a higher dose to get the same benefits. Potentially with CBD, you actually may be able to, after you've been on it for a while, actually lower the dose and still get the same benefits. Interestingly enough, CBD interacts within the endocannabinoid system, but almost many of the 65 targets are outside of the endocannabinoid system, interacting at various places to help balance and create what we call homeostasis. Now, let's see, how does CBD work? So again, CBD has multiple targets. So we know that most of the targets of CBD are throughout receptor systems that we have in our brain and in our body. It also works at ion channels through enzymes and also compounds called transporter protein. So let's look at receptors first. So just a quick definition of what a receptor is. So here on my slide, you can see the receptor kind of like this little Y-shaped sitting on a cell wall. And what happens is a ligand or a chemical comes along and binds to it like a key in a lock. And when the key hits the lock, it tells the cell to send a certain message. So you can see it's all basically a messaging system. And so receptors aren't always key in the lock in terms of binding and causing a reaction. Remember, you can get a key in there that can block the effect. You can get a key in there to give an opposite effect. So we'll be discussing this, but remember that CBD works through many receptors, as you can see the list on the left: cannabinoid receptors, glycine receptors, GABA receptors, and so on. And I'll go through this to explain how CBD gives the benefits of anti-inflammation, anti-convulsant, and so on through these various receptors. One of the things that we say about CBD is that it is a promiscuous molecule. And promiscuity in science means that it has multiple sites of action. It's also very redundant through a number of these receptors. You'll hear me talk about it gives an anti-inflammatory effect through various receptors, or anti-convulsant effects through variant receptors. This is a very nice way to help treat conditions in that it's not just one mechanism, it's multiple mechanisms of action that kind of coalesce to give the benefits. Now let's look at cannabinoid receptors. So in the graphic here, you can see a type 1, what's called CB1 receptor. And you can see that THC binds just like a key in a lock. It fits the receptor and binds to it. But CBD does not do that. CBD binds to a secondary site on the receptor, not the main site, okay? And what happens there is that CBD then acts, and the term I like to use, like a traffic cop at an intersection, kind of regulating who's going through the intersection. So what CBD is doing is it's regulating how tightly THC binds to the CB1 receptor. And the terminology that we use for this is a negative allosteric modulator, meaning that it helps to decrease or mitigate some of the binding affinity, how tightly THC binds to the CB1 receptor. And it's very important to understand. So if you took 5 milligrams of THC and you had never taken THC before, that would be you would feel that. You would definitely get that effect. When CBD is present in a similar amount, or in more a higher amount than THC, it mitigates how tightly THC binds to that receptor. So the effect of THC is a little bit less. And this is why for many people, they like to include CBD with their THC use so that they don't have some of the unwanted side effects of THC, like feeling paranoid or getting anxiety or even having a fast heart rate. Now, here's another receptor where CBD works, and this one's quite fascinating. So we have these receptors in our brain and spinal cord called glycine receptors. And glycine receptors are receptors that receive messages from your body and send it up to the brain, including pain messages. And so we know that CBD acts as what we call a positive allosteric modulator at the glycine receptor. What does that mean? That means that it helps the glycine, enhances the way glycine binds to that receptor, and that results in inhibition or suppression of that pain message. So it helps decrease that pain message that gets to the brain. And as you can see on the graphic, it says modulators that increase glycinergic transmission. What that means is modulators that enhance glycine binding to its receptor, reduce nociceptive pain signals. So CBD acts as a traffic cop at this receptor differently than at the cannabinoid receptor where, and THC. This actually enhances the glycine to enhance pain relief. We also know that CBD works at GABA receptors, and again, enhancing the way that GABA binds to the receptors. And in the graphic, you can see this is a schematic of a GABA receptor, and there's multiple different binding sites. And you can see on here, so you can benzodiazepines bind at a certain site on the receptor, ethanol binds at a certain site at the receptor, GABA binds at a certain site at the receptor. Well, we know that when CBD binds, it enhances GABA, and GABA is a calming neurotransmitter. It's a neurotransmitter that's anti-anxiety. It also helps, it's also anti-convulsant. So CBD helps to enhance the calming GABA that your brain is already making. Now, sorry for the busy slide, but this is also a fascinating receptor, the GPR55 receptor, and it's thought possibly to be a third cannabinoid receptor. And this is a receptor that's involved in many different physiologic modalities in the body. So cancer, pain, obesity, diabetes, gastrointestinal, and so on. Its ligand is this. A ligand means the chemical that naturally binds to it that your body makes is something called LPI. And we know that LPI is increased with seizures, and then it binds to the GPR55, which then triggers more seizures, and it you get into this vicious cycle. CBD appears to block the GPR55 receptor. So when it attaches, it displaces the LPI. It doesn't let the LPI bind to the receptor. And by doing that, it has anti-convulsant effects. So by blocking that receptor, it decreases glutamate, which is a neurotransmitter that excites your brain, which we don't want when we have seizures, but it also increases GABA, which we've already talked about, is a very calming. So by blocking the excitatory neurotransmitter and enhancing the calming neurotransmitter, you get decreased seizures. We also know that this receptor has been found to promote cancer cell metastasis. When it's activated, it tells cancer cells to spread. And by blocking that, we get an anti-cancer effect or anti-metastatic effect. GPR55 is also upregulated, meaning it's more active in obesity and type 2 diabetes. And again, by blocking it, we can help reduce some of these metabolism issues. And additionally, GPR55 is upregulated in osteoporosis, which is breakdown of bone. And if we block that, we get a decrease in that breakdown of bone. So there's multiple benefits from CBD's interaction with this particular receptor in the way that it blocks this receptor. Now, in terms of serotonin receptors, there's two receptors, 5-HT1A and 5-HT2A receptors, but basically these are serotonin receptors, and they are all over your body, and they are associated with emotion, mood, appetite, pain, nausea, and vomiting. Now, we know that CBD appears to bind to these receptors and also may be a positive allosteric modulator, again, working as that traffic cop to enhance the serotonin effect. And studies have shown that through these receptors, we see multiple benefits: neuroprotection, analgesia, pain relief, anti-depression, anti-anxiety, and anti-nausea and anti-vomiting. And again, remember that many of these effects, so remember neuroprotective, we're also seeing that with other receptors as well. So again, CBD targeting multiple different places in the body with redundancy in the effect. Pain relief through glycine receptors and serotonin receptors, for instance. Now, PPARs, this is a very interesting receptor. And as you can see in the graphic, you see a lot of arrows, right? So PPARs are just about everywhere in your body. They're nuclear receptors. So meaning instead of sitting on the cell wall, they sit on the wall of the nucleus inside the cell. And these receptors are involved in lipid storage, glucose and energy metabolism, cell differentiation, meaning cells changing what they do, and also inflammation. There are already pharmaceuticals on the market that bind to these receptors, and they're being used to treat high cholesterol, high triglycerides, and also insulin resistance. So this is a well-known target for pharmaceuticals. Well, CBD also activates these receptors, resulting in multiple benefits. So we get anti-cancer effects, neuroprotection. It's been shown that through these PPAR receptors, that CBD helps degrade plaque that builds up in the brains of animals that have Alzheimer's. We also know that by activating these receptors, you get decreased insulin resistance, very important for type 2 diabetes. And then additionally, by activating these receptors, you can get an anti-inflammatory effect in the gut. Remember, this research is mostly in animals, and certainly we'd like to see human research, but this certainly tells us that CBD activating the PPAR receptor clearly has tremendous potential for some very difficult conditions like cancer and neurodegenerative disorders and diabetes as well. Now, adenosine receptors are involved in cardiac rhythm and circulation, in kidney blood flow, immune function, sleep, inflammatory diseases, as well as neurodegenerative disorders. So if you look at the schematic, adenosine receptors, and most people who drink caffeine understand when they take caffeine, it gives them an alerting effect. Now, why does it do that? Through the adenosine receptor. So adenosine is a chemical that our brain makes that binds to adenosine receptors. And when it binds, it makes us feel tired. And what happens is, as you can see, caffeine is displacing the adenosine. As you can see that in the graphic. So the caffeine is the yellow, and it's occupying the space and not allowing adenosine to make you feel tired. So it stops the feeling of being tired, and that's why we all drink coffee in the morning. So additionally, CBD has anti-arrhythmic effects by binding to the type 1 receptor, and this may certainly be cardioprotective. And then CBD also has anti-inflammatory neuroprotective effects that multiple researchers have found by binding to the type A2 receptor through these adenosine receptors. Certainly more research is required to see what else happens at this interaction between CBD and adenosine receptors. Again, another very interesting receptor interaction. So other receptors that we know where CBD has action, opioid receptors. And what's interesting here is we know opioid receptors to be involved in, pain regulation and so on. And it appears that CBD may be a negative allosteric modulator of opioid receptors. Certainly we need to have more research, but it's thought that maybe this may be why CBD can help with addiction. And then another receptor, GPR18, also thought to possibly be another cannabinoid receptor. And this particular receptor is not a huge amount of research, but it appears that it is involved in immune function and microglia function. Microglia are cells in the brain that are activated when there is inflammation. So again, through this receptor, there may be some benefits for neurodegenerative disorders and any condition where there is neuroinflammation. Now, going quickly, just in for time, CBD mechanisms of action at enzymes. I'm not going to go into too much detail here, but we know that there's 32 identified enzymes where CBD interacts. And as you can see, I just have a short list here, but we know that CBD interacts with the cytochrome P450 enzyme system in terms of metabolism. We know that if you go down the list, you see COX and LOX enzymes. These are enzymes that are involved in inflammation, and CBD interacts with those, as well as CBD interacting with these other enzymes involved in metabolism, melatonin biosynthesis, and cytokines. Very interesting. This is a lecture in and of itself, but certainly tells us that CBD is very busy in your body when you take it. It's activating in many different ways. CBD mechanism of action for ion channels. So identified so far 10 targets. What are ion channels? So ion channels sit on a cell membrane, and you can see in the graphic kind of the little gray circles. That's the cell wall, and you can see the ion channel is the pink structure sitting there. And what ion channels do is they facilitate movement of ions in and out of the cell, meaning potassium and calcium and sodium going in and out of the cells. And this is extremely important for cell function. And ion channels are known to be responsible for basic physiologic functions, heartbeat, the function of your neurons, sending messages, muscle contractions, and so on. And I've listed here some of the ion channels where we know CBD to work, the TRPV family of ion channels, as well as others. And the implication here is that through these mechanisms, through these ion channels, CBD can influence thermoregulation, so body temperature, pain, inflammation, cancer, and anticonvulsant effects. Again, this is probably a lecture in and of itself, but just be aware that CBD is, again, not only working through the endocannabinoid system, but through these non-endocannabinoid physiologic functions that are extremely important to basic physiology. And then here's CBD mechanism of action through transporters. So transporter proteins are chemicals that we have that move around other chemicals. And we know that CBD appears to bind to the transporter protein. By doing that, it blocks the reuptake of your your inner cannabis compounds called your endocannabinoids. So remember, we make our own cannabinoid type compounds like anandamide and 2-AG, and those are released when we need them. They bind to the cannabinoid receptor, and then they're broken down by enzymes, CBD, and then transported. So CBD helps to block the transport, allowing those endocannabinoids to work a little bit longer and to have a little bit more of an effect. Now we're going to move on to CBG. CBG is cannabigerol, and it's, I would say, understudied, but we do have some research. You can kind of see all the research is somewhere between 2008 and 2015, and hopefully we'll see more coming out, but it has multiple mechanisms of action. What's interesting, it's a cannabinoid receptor antagonist. It also triggers these ion channels that you just learned about, the TRP family, by activating some of them and blocking others. We also know CBG to be an antioxidant and anti-inflammatory. It activates PPARs, which you remember, the PPARs are those nuclear enzymes that have a multitude of action. Interestingly, CBG is an agonist, meaning it binds to the alpha-2 adrenergic receptor. Now, the alpha-2 adrenergic receptor is a target of many pharmaceuticals, including those that work for hypertension or high blood pressure, for ADHD, for pain, for panic disorder. Also, this receptor is one that's targeted for to decrease cigarette craving, or also for withdrawal. So this is quite interesting in that CBG binds to the same receptor, potentially giving us effects similar to the pharmaceuticals that are already out there for this. It is a serotonin antagonist, and I read somewhere that it may actually block the way CBD is anti-nausea, because CBD is that 5-HT1A agonist. It binds where CBD blocks, so there may be a negating of between CBD and CBG for nausea and vomiting. And then CBG in one study has been shown to be neuroprotective as well. And so I've listed to the right what we seem to know so far in terms of potential clinical benefit: anti-cancer, neuroprotectant, a pain reliever in a neuropathic pain model, anti-inflammatory, anti-nausea, antibacterial. It can inhibit keratinocytes, which are skin cells that proliferate in psoriasis and other conditions, antidepressant, and also decreases intraocular pressure. So this is what we have from the literature. Now, clinically, in my medical practice, I've been using CBG probably for at least 3 or 4 years, maybe a little bit longer. And no question that I see patients who report anti-anxiety, definitely mood enhancement, antidepressant effects. We see anti-inflammatory and pain relief, either alone for some people, but I would say more likely in combination, like entourage effect with the other cannabinoids. I have a number of patients who have found topical CBG or oral CBG or both to work well for psoriasis. In my patient population of children with autism, I've seen improved speech, decreased anxiety, and improved focus. Not for every child, but many of them have found that CBG added to an already existing regimen gives these benefits. In terms of dosing, I have some patients who cannot tolerate large doses. We take very low doses, like 2, 3, 4 milligrams. But then I have other patients that take 40 plus milligrams, anywhere from 1 to 3 times a day, and get benefits in that way. In terms of side effects, really the only side effect I've seen is that for some patients, CBG can be very alerting at nighttime if they take it in the evening. Again, not everybody, but when I first start CBG in a patient, I recommend just a morning dose so that I don't want to disrupt sleep and create havoc for the patient, because if they're sleeping, we don't want to take that away, or if their sleep is bad, we don't want to make it worse. So again, I usually recommend starting morning dose only, see how patients feel on it, and then sometimes we'll add a second or even a third dose depending on their response. Now let's move on to THCA. THCA is basically the raw form of THC, and as you can see in the picture here, These structures are basically identical, except for what you see as the red part of the structure. And when you heat up THCA, this part cleaves off and you end up with THC. So what we know so far on THC, and again, understudied, and would love to see more research on it. We know that it's a possible type 2 receptor agonist, meaning it binds to the cannabinoid type 2 receptor, which is great in that it has a direct effect on immune function, helps with gut, it's anti-inflammatory. We also know that it's a PPAR agonist, again, going back to those nuclear receptors. So it gives an anti-inflammatory and neuroprotective effect. It's a GPR55 agonist, again, similar to CBD, binding to that receptor, giving an anti-seizure, anti-inflammatory effect. And then again, the TRP family of ion channels, giving us anti-cancer, pain relief, and anti-inflammatory. And again, notice that there is redundancy with CBG and CBD, where these all can work at multiple sites, but also overlap each other, right? So GPR 55, we know CBD works there, so does THCA. And that's why for some patients, I find that, let's say in a child with epilepsy, I've got patients where they get a certain effect with CBD. And then when we add in THCA, we even get a better effect, potentially working at very similar, but also additional targets. THCA is not thought to cross the blood-brain barrier. However, potentially there's some evidence that certain conditions such as epilepsy or conditions where there's autoimmune effects like multiple sclerosis, that the blood-brain barrier may be compromised. And so it's potential that the THCA is crossing through the blood-brain barrier in these patients. We're just not sure of that yet. Clinically, I use THCA in my patients for seizures, autism, pain, inflammation, anti-cancer, and dementia. And I should also add in there any type of inflammatory bowel disease as well. We know THCA is less lipophilic than decarboxylated cannabinoids, so it seems to be absorbed a little bit better. The dosing range is quite wide. I have some patients that respond to very low doses, 1 milligram, 5 milligrams, and then I have other patients that require much higher doses. I have a young patient who's about 10 years old now. He's been seizure-free on 20 milligrams twice a day of THCA for about 2 years now, doing quite well. I have other patients also doing well with THCA as an anti-seizure medication, some in higher doses. And the big question here is THCA is considered to be a little unstable in that it wants to convert to THC. So once the flower's harvested, the THCA exposed to heat or light, oxygen, some of it will convert to THC. So all of these effects are very difficult to tease out whether it's THCA or THC, because all products that have THCA as the dominant cannabinoid are going to have a small amount of THC. And again, it's hard to know which compound is doing what. Clinically in a patient who's not doing well, if they get great benefits, of course, who cares if it's the THC or the THCA, but as a scientist, it would be nice to be able to isolate and study THCA to see exactly what it does clinically and not have THC in the picture, kind of confusing things. We know that, of course, since it's raw, it's going to be quite rich in terpenes in many of these preparations, and that also may account for some of the benefits. I really haven't seen too many side effects in patients with THCA. You can see impairment if a large dose is taken and there's a fair amount of THC in the product. I've had some pediatric patients who are medically complex, who can have some funny paradoxical effects where they get, instead of calm, they may get super hyper or super emotional on this, and that may or may not be a THC effect. But in general, THCA seems to not have too many side effects. And again, starting low, titrating up, looking for the dose that suits you or your condition is always the way to go. Now let's talk about CBDA. So CBDA Also understudied, it's the raw form of CBD. And there's a handful of studies out there. It's definitely being looked at more so now because, again, like THCA, it is less lipophilic and seems to be absorbed better. So it's a serotonin receptor agonist, giving us anti-anxiety and anti-nausea effects. It inhibits the reuptake of anandamide, your own inner cannabis compound, allowing anandamide to work a little bit longer and also giving an anti-inflammatory neuroprotective effect. It also it inhibits 2-AG, which is one of your endocannabinoids, and there's a question of if this is involved in glucose metabolism for this particular mechanism. Again, involved with those TPR channels for pain and inflammation. And CBDA is a COX enzyme inhibitor, giving us anti-inflammatory effects and potential anti-cancer effects. And notice that here I don't have anything in terms of the direct anti-seizure effects, but what we have found out, let's go to the next slide here, is you can see here the second bullet point is CBDA-rich extracts. So these are not isolates. It was an extract containing other cannabinoids and terpenes, was anticonvulsant in a rat model, and that was just published earlier this year. So I spoke to a family yesterday who we've been starting we started the CBDA a few months ago, and as we've gone up, and this is a child who's really struggled with intractable seizures, meaning they have never been controlled, no drugs ever really helped her. And now that we are titrating up on CBDA, she's also on THCA and CBD. What we have seen now is she went over 30 days, the longest time she's ever gone without a seizure, as we're going up on the CBDA-rich oil that's been added to her regimen. And she's getting about 10 milligrams twice a day. So it's not a very high dose compared to CBD, where we know often very high doses in the hundreds of milligrams are needed. Again, CBDA is thought not to cross the blood-brain barrier. And again, potentially it does cross in patients with certain conditions. The dosing range that I'm finding, I usually start low, but clinically, I don't see the anti-inflammatory effect till about 25 milligrams or higher. I have a patient who I've followed for many years who has rheumatoid arthritis, who was a young woman diagnosed, and now she's a young adult, and she's on 200 milligrams a day of CBDA with some very nice anti-inflammatory results, relief of pain. And I have heard of other patients taking even higher doses. Clinically, again, what am I using it for? Anti-seizure, autism, pain conditions, and certainly inflammatory conditions, also anti-cancer, and for some mood enhancement as well. I have yet to see side effects with CBDA, and I say little to no side effects. Somebody may say that it doesn't suit them, but I really haven't seen anything that is very concerning. And that's the end of my presentation. Here's some of my patients I've had the honor to take care of. Thank you so much for listening.